We build deep learning models in order to detect signs of what's happening in the brain, in particular with Alzheimer's disease.
We're here at the Alzheimer's Association International Conference. I'm Logan Plaster with Startup Health. At Startup Health TV, we celebrate the entrepreneurs and the innovators who are transforming health. And I'm here with Catherine Bornbaum from RetiSpec, the Chief Business Officer. Catherine, great to see you.
Great to see you too.
Want to walk with me?
Yeah, absolutely. Let's do
So,
it.
RetiSpec recently joined the Alzheimer's Moonshot at Startup Health.
Yes.
And you did so at a very exciting time. You just raised $10 million.
Yes.
So tell me a little bit about that raise.
Oh my goodness. Following 2023, which was a bit of a tough landscape in the fundraising era, we are very, very fortunate to have just recently closed 10 million USD. And this was a round that was led by iGan Partners, who is a group that really focuses on medtech innovation, and particularly in Alzheimer's disease. So we're very fortunate. And we have some new strategic investors that we are very, very honored.
I heard about that.
Yes. We're honored to be working with them.
Who are they?
Eli Lilly,
Okay.
the Lilly Ventures arm of the company, and they are just making waves in the Alzheimer's and neuroscience space, so we are delighted to
Okay.
have them alongside us. And also a group called Topcon Healthcare.
Yes.
And so this is the company that they are one of the most significant manufacturers of fundus cameras, which are cameras that take a picture of the back of the eye, which is what we actually use in order to understand what's happening within the body and in particularly in the brain.
Okay, so speaking of fundus cameras, I know RetiSpec is a special kind of camera that sits on top of a typical eye exam
Yep.
camera, fundoscope.
Yeah, exactly.
What are some of the challenges and opportunities with trying to come to market, working with eye doctors, primary care physicians, and trying to add technology onto existing technology?
Yeah, so there's a couple things to unpack there. So I think, first of all, the fact that we use cameras that are already widely available in eye doctors' offices is a big strength. What we do with that is by adding the extra information on top, we get that little sensor and we can capture extra data. And we build deep learning models in order to detect signs of what's happening in the brain, in particular with Alzheimer's disease. And so what we do is we just simply swap out the camera, do a calibration, and they're ready to go. It's really, really simple. What you're asking is about really what happens after that.
Yeah.
After you swap out the camera and the software is ready to roll, how do you work with clinicians to make sure that they're ready to deliver this information? And we actually were quite concerned about how we might integrate this into clinics. And so we did a couple pilots. One was sponsored by the Davos Alzheimer's Collaborative, where we actually put our cameras in optometry offices. We invited folks who were above a certain age, in our case 55, to see if they were interested in having a scan. And what we found is that it was really, really much easier than we thought. The optometrists were excited to talk to their patients about brain health, and we didn't realize that they actually do that every day. They look for signs of stroke, of brain tumors, and they have these conversations with their patients every day. So it wasn't completely new. We were just expanding on that scope of practice. And so following that Davos study, we actually followed what happened to these people. Did they go to primary care? Did they go to a dementia specialist if that was relevant? And actually, in all cases, they did. They followed up with primary care when relevant. And if they couldn't, then we helped connect the dots for them to a nurse practitioner who could have the conversation. So
Now, obviously, it's awesome to have greater access to brain health scanning at a primary care doctor. Is this a big capital investment? Is this going to be a big hurdle for, let's say, a small town eye doctor, physician to do?
it's a great question. So the short answer is no. We're not asking folks to buy a really expensive piece of equipment. In many cases, they already have the fundus camera, so we're just adding the sensor on top. But we roll this into a really affordable subscription model for folks. They're very familiar with this. In eye care, they already do a lot of these purchasing agreements through subscriptions, or they just go along with the cameras that they already buy. So it's a very familiar business model for these folks.
Okay.
Yeah.
What are you most excited about what you're seeing at AAIC?
Oh my goodness. It is such a heartening time in Alzheimer's disease.
Okay.
We have just had the approval of the new Eli Lilly drug, Kisunla, and we are seeing some exciting top-line data coming out of some other companies like Alzheimer very soon. So I think there's huge innovation happening on the diagnostic space, the therapeutic space, and even in some of the complementary areas. So some of the startup health companies that we're seeing innovation across the continuum, from the caregiving experience through to supportive videos. I think there's just innovation everywhere, and I'm so excited.
Is that new, or are we just sort of seeing it now? Like, is there actually an inflection point happening in innovation in Alzheimer's?
I think absolutely yes. I think a lot of it is driven by the success of the therapeutics after 40 years of failure, but there's so much energy and focus on, okay, now that we have options on the therapeutic side, how do we support the rest of the ecosystem for patients, for families, and everyone involved in their care? So I think there's a lot of energy coming out right now, and we are just very excited to be a part of it.
What should we be looking forward to from RetiSpec over the next 12 months?
So with the close of our round, we are looking forward to some significant milestones. So we'll be gearing up for regulatory and all of the efforts that go into that, and getting ready to bring this out to clinics. So
Amazing.
yeah, it's
Amazing.
a really exciting
All right.
time.
Catherine, we'll wish you the best.
Thank you very much, Logan.
All right, thanks.
Thank you.